Okay, you did the damn thing. We're done with respiratory acidosis, aren't we? Let's explore metabolic. When it comes to metabolic, I want you to focus on the organs of the kidneys. I said this before. I said anytime you're talking metabolic, you're usually talking about kidney issues some way or another. Okay, so we're going to explore that now. Does diarrhea have anything to do with kidneys? Yes or no? No, it really doesn't. I mean, just because you're shitting doesn't mean you can't piss. All right, now, does DKA or DM have anything to do with kidneys? Yes. If you're smart, and you are, you know that the #1 cause of kidney failure in America is diabetes. You know that if you've been a diabetic for 10 years, you probably have some kidney involvement. You know that if you've been a diabetic for 20, you absolutely have some kidney involvement. You know that if you're a diabetic and your doctor is not screening you for kidney failure, they are negligent, like my father's doctor was. Yeah, that part. So how do you be a diabetic for years, go with your first visit to your doctor, and your doctor doesn't, on the initial visit of meeting you, knowing you've been a diabetic, how does he not screen you for kidney failure? How does that not happen? And how do you then tell your daughter 11 years later, they told me I got kidney failure and I'm gonna need dialysis? What? That shit don't happen overnight. What the fuck? This the first you heard about that, Daddy? Well, yeah, they never said that before. Give me your my chart. Fuck this. Give me the password to your little my chart. Let me see what the fuck is going on around here. I look in the little my chart. I'm getting hot. My head is starting to hurt. I'm boiling mad. I'm ready to fight, Project Chick style. But I know you catch cases as nurses, and somewhere I heard that you can't be a nurse with a case. That's what I heard. So I'm like, okay, calm it down, sister girl. Calm the fuck down. Let's just kind of make sure you seeing what you seeing. What I saw in the chart on his very first visit with this doctor was that he had this. It's a long ass word, but I know my babies can handle this shit. So, cause I taught you how to break shit up. What do you think urea means? Urine. Very good. What do you think micro means?
Small.
Tiny. Very good. What do you think albumin means? It's a type of what? Protein. What the fuck? His very first visit to that doctor, he had microalbuminuria on the urinalysis. Now you got to know where we're going with this, because a urinalysis is a cup of urine you dip. Are you still with me? What should have been done and wasn't, when you see that, because it's sure as hell not normal, is that you should have had that brother do a 24-hour urine. Oh, I looked, I searched, I looked. I ain't seen no 24-hour urine. Not that visit, not every 3 months after for the next 10 years visit. Took a while, but I looked it all up. But you've been with this mother sucker for 11 years, and you just now being told? Now you are probably a lot like me. You're probably sitting in your seat right now. Huh?
I said call Michigan.
Oh, he'll make them pay.
No.
Now, the baby is crazy. She want me to go ahead and call the lawyers. My dad wouldn't let me. But if it had been mine, I'd have called her. She ain't got good sense. But let me tell you what's going on. Misney will make him pay. Y'all better know. But he also gonna make you pay. All your money gonna go straight to that motherfucker because he advertising with your dollars. But anyway, shit. Here we go. You might be thinking like me if you're intelligent. You may be saying to yourself, because you're a critical thinker like I am, you may be saying, well, what the hell made this motherfucker check his urine the 11th year? Oh, I got that answer too. The bitch retired and he got a new doctor. He never would have checked it. He retired and he got a new doctor. And that new doctor gave a shit. Because when you're new to my practice, I'm going to review your history. There's a novel idea. And when I reviewed your history, I saw 11 years ago you had microalbuminuria. And when I reviewed your history, I see this doctor ain't never did a 24-hour urine. And when I reviewed your history, I seen you've been a diabetic for a while. And when I review your history, I see you've been well controlled with your little 5.6, 5.7, 5.9 A1C. But you've been a diabetic a while, so I still need to check you for everything. Even though you've been well controlled because you got a daughter who always tells you what to eat and not eat. But the problem is with the daughter who tells you what to do and not do, you had it before you even met this doctor. You already had pre-existing kidney failure, as evidenced by the fact that you have protein in your urine. My God, on the first visit. So I can say, don't eat this, don't eat that all I want. Daddy, let me buy you this, let me buy you that, because it's better than what you buying over here. I could do that with my daddy all I want. He already had pre-existing kidney failure. And no one ever told him, because I'm thinking he doing good, because every 3 months you going to the doctor, you telling me your A1C is well controlled. I know I will kill you in Jesus' name if it ain't, because you daddy, and you got to listen to your nurse daughter. This right here, for those of you who already did renal, you know that this is called a glomerular filtration rate. You also know that technically anywhere above 100 is great, but in the hospital setting, they usually say 60 and above is fine. This man walked out that doctor's visit calling me with this bullshit. Yeah, exactly. Because here's reality. Once your number drops below 20, you get on the kidney transplant list. Yeah. Once you hit 15, you typically need dialysis. So you went from happy-go-lucky doing your thing to all of a sudden, I need you to remember to the day you die that kidney failure takes 10, 15, 20 years to develop. I need you to really remember that. Because see, if you remember that and you know that and you see something crazy like there's no testing for kidney failure in a diabetic, like, you know, you just would jump crazy with it. Because like, where they do that at? Because it takes time. Now, the last thing you got to know about kidney failure, it's irreversible. I can't reverse it. I can't make it better. I can't treat it. I can't improve it. Where it is where the fuck it is, and where it's going to start getting worse from. Now, I can slow it down. Yeah, see, because had I known about this, I'd be like, Daddy, don't let me see no orange juice in your refrigerator. You know, because it was there every day that I ever went to my dad's house. It's always in the fridge, right? Because, you know, he likes orange juice. Daddy, them bananas on your refrigerator, you can't have them. See, I would have told him that had I known you had kidney failure, because potassium can kill the kidneys. But you see, you ate that every day with your cereal. Because who the fuck knew? Who knew that your potassium-filled bananas and your potassium-filled orange juice is making this worse real quick? Because who knew you even had it? Who knew? You told me they told you you were fine, you checked out good, and that's what I believe. I'm not going to micromanage your shit because I think that doctors have a brain cell activity or two, a little synapse going on, I hope, but maybe not. What I've learned in my long-legged life is that they don't do shit necessarily, and they don't know no more than you do necessarily. And then if you black, it's called healthcare disparities, because they really don't give a fuck. And that's real talk. Now, so here we go. We got a father who's been to the same damn people for 11 years. This man retires. You get a new provider. The shit hits the fan and you come tell your daughter you need dialysis all of a sudden. When I know and you know that you don't get told you need dialysis all of a sudden. This is a process. We're leading up to it. Okay, you're in stage 4. Okay, you're in stage, you're in stage 1, 2, 3, 4. You know yourself because you got the packet. And that's why the packet matters. Because if you look in your renal packet, it says it. Stage 1 to 2, 3 to 4. End stage. Trying to teach you and help you understand that this is a process. So when you see kidney failure up here, we have to think, how did kidney failure make the list of acidosis? Oh, it's kind of simple. When you have kidney failure, you can't get rid of that. What's that? You can't get rid of this. Uric what? Uric who? And what is it really? Acid. So when you have kidney failure, what's building up in your body? Acid. You now have acidosis. Then that means you have to extrapolate from that. Anything that could give you kidney failure can give you acidosis. So let's look. This, we started here. We said, does a diabetic or DKA have anything with kidney failure? Yes, because number one, we said diabetics' kidneys fail over time. Some of them, 10, 15, 20 years, will fail. They may not fail to the point of dialysis, but they are going to be weaker than anybody without diabetes. This right here is outright kidney failure. So let's examine how the DKA patient gets outright kidney failure, because that sounds a little extreme, Shelly. Here we go. I teach you to remember it like this. D, K, A. The D stands for what word? Diabetic, which means what? Sugar is high. So you're not going to be on the test thinking that DKA is a low sugar, because I just told you that the word diabetic means high sugar. So if you just go to the test and remember to say out loud in your mouth, diabetic, ketoacidosis, you will never miss this the way you sometimes do in my class. So diabetic, ketoacidosis. Diabetic means high sugar. You good. But there's something else about DKA that is a little bit kind of hard to remember, if you will. And that's why I split up the letters so that you can give 3 meanings to almost every one of them. The second meaning to the D is that you are going to be completely dehydrated. You are going to be completely dehydrated because you are peeing your ass off. It's called polyuria, y'all. And you're going to be peeing 10, 15, 20 liters of urine. Now, you may remember us talking in boot camp. We said in boot camp that the normal amount of intake is 2 liters of fluid. Do you remember that conversation, boot campers? Do you remember us saying when we say push fluids, we do 3 liters? Do y'all recall that? Okay, so that means that you know the second part of that. And that is that I's and O's must equal. So if I took in 2 liters, then my urinary output is 2 liters. If I pushed fluids and got 3 liters in, then my output is 3 liters. I just told you that these people pee 10, 15, and 20 liters in a day. Oh my God, of course they're dehydrated. And can I just ask you, because you are completely with the program in this class. Can I just ask you, what controls blood pressure? Fluid. Now you done got rid of 10, 15, 20 liters off your body. What is your blood pressure doing? Crashing. Stay with that thought, because I'll be back. The third meaning of the D is, again, a little difficult, but you got this. It's dependent. Dependent on insulin, which means type 1. In other words, beloved, the type 1 diabetic has to have insulin to live. Do we all agree? So the D means dependent on insulin. DKA is not in type 2. No, it's in type 1 diabetes. And that part is hard, because I kind of think about like when the babies forget stuff, that's the one you forget. Okay, so you got your 3 Ds. She loves the D. You're done. Now let's look at the K. The K has 3 meanings as well. The K itself, I make you say it out loud during the test, means what, everybody? Ketones, right? Because again, we're staying in line. Diabetic ketoacidosis. So the first meaning, of course, is ketones. That's what's in the urine of this patient. The reason why you give a shit is because type 2 doesn't have ketones. Type 1 diabetes, insulin dependent, has ketones. That's kind of important, LPNs in my class. RNs too, but LPNs, that's your test. So ketones. Now the second K, where's it at? Is potassium. Any way you shake it, this patient's potassium is either going to be high or low. And for your purposes on NCLEX, I definitely would go with high initially. It can be either, beloved, but I need you to go with high. If you are given a choice, go with the high. Does that sound good? Okay. Now, that's because of what I just told you. The blood pressure is going to be low because you're dehydrated and fluid controls blood pressure. When the blood pressure is low, we're going to show you how kidneys fail. And then the kidneys fail, they can't get rid of potassium. That's why you're rolling with the high. Because I know you learned that when you pee out potassium, but this patient is just peeing water. They're polyuria, they're just peeing water. They're not really peeing any kind of waste product, they're just water, okay? Now, the K, the last K is compensation. So what is that? Yes, Kussmaul's, you did remember. In other words, when a patient has acidosis, they're going to try to get rid of CO2 any way they can. Remember in your notes, beloved, that Kussmaul's is, well, I'm going to ask you, is Kussmaul's breathing slow and shallow or rapid and deep? I'll ask you. You got to pick one. Slow and shallow or rapid and deep? We'll start in the back with my baby on the right. The one in the black by the little wall, is it slow and shallow or rapid and deep?
Slow and shallow.
What you got?
Slow and shallow.
What you got?
Slow and shallow.
What you got?
Rapid and deep.
What you got?
Rapid and deep.
What you got? What you got?
Rapid and deep.
What do you think?
Rapid and deep.
What do you think?
Rapid and deep.
How about you?
Rapid and deep.
How about you?
Rapid and deep.
How about you? 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 How about you? How about you? What you got?
Rapid and deep.
And you?
Rapid. Rapid and deep. Rapid and deep. Rapid and deep. I'll do that.
Yeah, because watch this. What am I blowing off?
CO2.
Compensation. I am retaining so much because of the acidosis. I'm trying to get rid of it. That's what compensation means. I'm trying to get rid of it. Y'all good? Okay, so that's compensation. That's not cause. That's not cause. That's compensation for the fact that I'm already acidotic. And I'm trying to get rid of acid any way I can. Very nice job. So that's Kussmaul's. Y'all gonna be all right because this show case study will be on there all the time. Okay, we got one more. Acid. You know it's acidosis on your chest. Let's give a couple meanings to it. Why not? Blah, blah, blah. Okay. The A is obviously acidosis. You know some kind of way acid is in the body. It's not leaving. It's overtaking the body. Blah, 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 blue, blue, blue. But the issue with this acid is that, yes, Kussmaul's is a way that you compensate, but you're going to have another way that you compensate. And look, A for abdominal complaints. So you're throwing up. You're doing a little vomiting up in here. Because you guys know that if I vomit, I get rid of what kind of acid? Hydrochloric acid. Oh, that's a good thing. That's called compensation. I've got so much acid in my body, if I throw up, I can get rid of some of it. Y'all see how that works? So I'm nauseous and throwing up his head. I'm just really sick when I show up. The last A is just remember this patient needs ABGs. This patient needs ABGs, arterial blood gas, to check for something you don't understand, and nor will I explain it because it's way above your pay grade, and that's over there in PhD Dr. Land. The word for this ABGs, the reason why we're doing it, is to check the anion. Just write that down, don't worry about it, do your thing. To check the anion balance. And you don't care, trust me. Way, way, way too high above pay level. Okay, if I was teaching med students right now, which I do, I would go into detail, but I'm not. So hell with it. Okay, now, so you're good. Now, here's our deal. Let's find out what's going on with that blood pressure, because you know I kind of skipped over that really fast, but it's in your pink packet because everything is an oh my God packet. Let's go over to page 10 and mosey on down to the very bottom of that page in your oh my God packet. Y'all with y'all, girl? Okay, boo-boo kitty. Now, what does it say at the bottom? Okay, all shock means low BP or no BP, and that means no PP. All right, what did we say you were doing up here? We said you were dehydrated because you're peeing how much? 10 to 20 liters of fluid. My God. So isn't that fluid volume? Yes. Wouldn't that mean that you're at risk for hypovolemic shock because you're losing so much fluid volume, right? Okay, now, so these patients can show up in shock, even if they haven't crossed the threshold into shock. You said it earlier. You said that fluid controls your blood pressure. So let's examine just that part because I'm so proud of you. Your asses is right. So if you are hypovolemic, but not in shock yet, you would agree you have low volume of fluid in the body. Your blood pressure is also low. Your blood pressure, which is BP, right? Blood pressure. B for the blood, P for the pressure, means this. It means blood perfusing kidneys. BP. Keep it on the BP. So BP means blood perfusing kidneys and every other organ in your body. Brain, liver, everything. But the kidneys are the focus here because they're going to be the first organ that fails. Okay, so you got it. So we said no BP, which is no blood pressure, which then is what? no blood perfusing kidneys, which then means the kidneys can't make urine. No BP, no PP. That's going to be an early sign that your kidneys are failing. You can't even make urine. You've got oligohydramnios or whatever, oliguria. Not dramnios, but oliguria, you know, low urine. So you got this. You're not making urine. Now, you guys learned that whole 30 cc garbage. You could retain that for 15 minutes, but your test won't have it on there. Remember that, learning that 30 cc's an hour type shit? Nah, that shit ain't on there. Here's what I want you to write down over there by that little bottom page. Less than 400 milliliters in 24 hours. They've been liking that lately, sorry. Less than 400 milliliters in 24 hours. Now, question. Do we pee every day? Yes. When you go pee across the hall or down the stairs with all the student bathrooms, when you come back up in this room, is there still pee in your bladder? Yes or no? Yes. Why? Because you're continuously making urine. Isn't that true? If you're not, something's really wrong with you. So then, let me ask you. If we think about everybody in this class who were just, you know, there's a couple people with some things going on that we know about, but for the most part, everybody in the class, when you pee, do you pee every hour? No. So would you say that it's hard to figure out per hour if you have oliguria? Yes. That's why your test doesn't like 30 milliliters an hour. Because who the fuck is measuring every hour unless you have what? A catheter, you're in ICU, you're critical care. Nobody's doing that shit. So in order to kind of hit you upside your head where it matters, we let you as nurses who work on a regular floor understand it quite differently. We say 400 in a day. Now, if you were to do the math, it wouldn't add up. Because then you'd be like, well, that doesn't add up. It doesn't matter. Your test like 400 in a day, okay? That's gonna be critical for you to know. So they do that for a reason, which I think is a logical reason, and that is most of you are not gonna be measuring people every damn hour. So you might need to kind of look at a more shift-wise approach. You worked 12-hour shift. Why is the output only at 200 at this point? That would be a red flag. Are you seeing where I'm going with this? Okay, so it's a little better measurement, really, than that whole 30 milliliters an hour that we were all taught in college. Okay, now, let's move on with some of this whole urine every hour thing. I like to teach you normal so that you kind of get how outrageous abnormal is. Any given time that we do go pee in a cup, let's just say Shelly's being really weird and she wants everybody to measure the urine that they do when they do have to go pee, because she's being really weird. The average amount of milliliters at the time you do go pee is about 180 or 200 milliliters. Are you still with your girl? Now, if you think about normal, and that's all we're doing now, we're trying to help you understand normal. Would you say that it's probably every 3 to 4 hours that we pee? I would. I think that's reasonable. Maybe 3 to 4. If you're a nurse, oh God, you never pee. But we're not talking about nurses. We're just talking about the typical person. So if you think about that, you can see how easy it would be to understand that we're definitely over 400 milliliters in a day. Y'all good? Okay, because I had to kind of go there with the normal, abnormal stuff. Now, let's look at one more thing. When it comes to your kidneys failing and they're not putting out enough urine in the day, and they are less than 400 milliliters in that 24-hour or whatever. When you look at that, what else is not doing too well? What's not coming out? uric acid. Now you can see why this and this is metabolic acidosis. Now, you, my love bugs, my angel faces, when you come back from this break, you're going to tell me, and you're not going to look it up because you're smarter than that, plus you have shit to do while you're on your lunch. You're going to think about maybe in the back of your mind why this one is metabolic acidosis. But until then, you're going to lunch, and you know how we said before you went on your break that you have last one of our guy, Khalif Browder, to watch. And it's the best one of all because it finally gets into cardio in a way that only you can understand. Nobody else in that movie would. So if you are new to my class, you are told that you need Netflix to join it. If you don't have it, you're going to have to steal somebody's and find, look it up like this because it's not easy to look up on Netflix. Look it up just like this, everybody. Go to Netflix, put this word in first, and then you look up Khalif Browder. And it's episode number 6, the very last one, and it is the best one when it comes to cardiac, so pay attention to the cardiac. Okay, so you have your episode to watch. You're going to come back here at 12:45. Bye, get out. See you soon. And like I said, really try your best to steal somebody's, honey, because it is the best cardiac on there. Hi, baby.
If we need to show the place from earlier for an hour.
You show it to me when you come back from your lunch, because everybody kind of dribbles in and you can show me. Show me your test scores after lunch, beautiful.